Vitamin D is one of the most commonly taken supplements, but it is also one of the most commonly misdosed. In this video, I'm going to walk you through how vitamin D dosing actually relates to blood levels and what those lab numbers mean. And if you haven't had blood work done, what the safest amount to take really is without overdoing it. This is not about extremes. This is about using vitamin D intelligently and in a smart way. If we haven't met, hi, I'm Maddie. I'm a pharmacist, and I focus on helping people understand supplements the same way I explain medications, evidence-based, calm, and practical. Let's start at the foundation and build from there. First, we need to talk about what vitamin D blood levels actually represent. So when you get your vitamin D checked, the lab is measuring something called 25-hydroxy vitamin D. This is the storage form of vitamin D in your body, and it gives us a much better picture of overall status than just that vitamin D supplement you took yesterday. So labs, they usually report this in nanograms per milliliter or G per ml. In general, levels below 20 are where it's considered deficient. Around 20 to 30 is often labeled as insufficient but not extremely deficient, and roughly 30 to 50 is considered the adequate range for most people. I will say there is some debate about optimal levels, but these ranges are widely used. Between 30 and 50 is a safe bet that's going to generally be considered optimal, but at least gives us a solid starting point. So once you understand that lab value, the next question becomes, how does a supplement dose actually affect that number? And this is where things tend to get oversimplified online. There's a rough estimate that you'll see in some places that every 1,000 IU or international units of vitamin D per day raises blood levels by about 5 to 10 points over time. But I will say this is an average. It is not a guarantee, and vitamin D absorption varies so much based on body weight, gut health, baseline vitamin D levels, sun exposure, whether you take vitamin D with a fatty meal. This is why two people can take the exact same dose of vitamin D and end up with way different blood levels. Let's talk about dosing. So if you have recent labs and you've had vitamin D done, it becomes much more individualized. So for example, if someone is mildly low, say in their low 20s, a dose around 1,000 to 2,000 IU daily may be enough to gradually bring those levels up. But if someone is more clearly deficient, less than 20, providers may recommend higher short-term doses followed by a lower maintenance dose. So high at first, then drop that down. This is where the healthcare provider matters because vitamin D is a fat-soluble vitamin, and dosing needs to match the situation. It is not just a general dose. It needs to be individualized and personal. But most people watching this probably have not had blood work done just super recently. So let's talk about that. If you haven't had your vitamin D level checked, the goal is to stay within a conservative, low risk range. And for most adults, that typically is 1,000 to 2,000 IU per day. That's generally considered a reasonable place to start, and that's typically the amount that you will see in most just generic multivitamins available, which makes sense. I will say some people take up to 4,000 IU daily, which is considered the upper safe limit for the general population, especially those that have not had blood work done. And I do not recommend defaulting to that amount without a clear reason or without talking to your doctor and your doctor telling you to take 4,000 or 5,000 a day. If you're supplementing without blood work, staying closer to that 1,000 to 2,000 IU range is typically and usually the safest and most appropriate approach. I do want to pause here and clear up a really common misconception and assumption that I've seen. But working indoors, like I work indoors 100% of the time. I hardly am ever outside except for maybe a 30-minute walk a day, and that's like when the weather's good. But if you work indoors, if you wear sunscreen, you're not getting much sun. That does not automatically mean that you need that 4,000 IU of vitamin D every day. Sun exposure is just one piece of the puzzle. Diet, absorption, body storage, and genetics can play a huge role in this. And I see plenty of people who work inside all day and still have perfectly adequate vitamin D levels. I also see people who spend time outside and they are low. So lifestyle is not the sole determination to determine your dose. This is why I'm cautious about people defaulting to that highest dose just in case. This also leads me to another question I get asked all the time, but vitamin D toxicity, it's uncommon, but it does happen. Because vitamin D is one of the fat soluble vitamins, excess amounts are going to be stored in the body. Very high doses over time can lead to elevated calcium levels, kidney issues, and symptoms like nausea, weakness, or confusion. So, more vitamin D does not automatically mean more benefit. Pretty much the goal is adequacy, not excess, which is super important when you come to your fat soluble vitamins. You may have also heard of the 50,000 IU weekly vitamin D dose, which is commonly prescribed by healthcare providers. This is not a casual supplement dose. This is a medical correction dose typically used when blood work shows a true deficiency. And when taken weekly, it averages out to about 7,000 IU per day. It's usually prescribed short term. Some people do take it a little bit longer, but it's not done indefinitely. And the purpose is to raise those vitamin D levels efficiently under medical supervision and then transition to a lower maintenance dose eventually. That's very different from someone deciding on their own to take high dose vitamin D without any labs. So let's talk about how to take vitamin D in a way that actually works. A few simple small habits can make a huge difference when it comes to vitamin D absorption. Taking vitamin D with a meal that contains fat is huge. Being consistent, daily dosing works better than sporadic high doses. And recheck blood levels after a few months if you've changed your dose can go a long ways. Vitamin D works best when it's part of a routine, not a reaction. So here's the big picture. Vitamin D dosing works best when it's guided by blood levels, not assumptions about lifestyle. Working indoors does not automatically mean high doses, and prescription vitamin D has a very specific role when labs support it. The goal is adequacy, consistency, safety, not extremes. Have I made that clear? The goal is not extremes. If you found this helpful, I share more supplement education like this, always evidence-based and easy to understand. So if supplements ever feel overwhelming, just know that you're not alone. This is exactly why I do this type of work. Follow me on Instagram, subscribe to my YouTube channel if you enjoyed this video. Thanks for watching, and I'll see you in the next video.